Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am missing my wife today. I am doing an early podcast because I have a flight I've got to catch early, so Janet will not be with me on the podcast today as she usually is on our regular scheduled time at 12:30 to 1:30 Pacific Standard Time. Every Monday, you can catch us on Facebook, Twitter, LinkedIn, and YouTube. So check us out there. Subscribe, follow, like, so you don't miss any episodes. We also have a brand new Facebook channel dedicated just to our podcast. So Health Solutions with Shawn and Janet Needham. Look that up on Facebook and follow that so you don't miss any episodes. Today, you do not want to miss out on this one. We are going to be talking about sex. And if you are uncomfortable with that subject, there are no questions that are off topic that we won't necessarily answer. So there might be some uncomfortable questions that come up. Please submit your questions, comments. Let us know what you'd like to hear about. We'll be having Jennifer Carlson on today. She specializes in health and wellness from Phoenix Health and Wellness out of Spokane. And she specializes in hormone balancing and diet, nutrition, all those things to help make us healthy. And sex is something that healthy people do regularly, and healthy people have sex regularly, and sex makes us healthy. So we're going to be discussing all that. Without further ado, Jennifer, welcome to our show.
Hi, Shawn. Thanks for having me.
Hello. And before I forget, Janet says hello.
Thank you. Hi, Janet. I know I was looking forward to talking to both of you.
Yeah. So thank you for rescheduling the time. I had a last minute flight that I have to get out to South Dakota today. So topic of sex. Let's talk about sex and longevity. Mm-hmm. I think that healthy people have sex regularly, and sex makes us healthy. I think it's probably as important as water and food. I honestly believe that. So tell us your opinions, Jennifer.
So,
by the way, first of all, introduce yourself.
Yeah,
please.
I'll give a little bit of a background first.
Background.
I'm not a sex therapist, not an expert by any stretch of the imagination, but I do feel at times through experience with patients and my over 20 years of nursing experience that I'm almost kind of serve as that role as psychologist for a lot of my patients. I've been a doctorally prepared nurse practitioner for the past 5 years. Initially specialized in pain management, and then got very interested in the hormone aspect and got certified in bioidentical hormone replacement therapy. And then I just opened my own business last year. It'll be a year in May that Phoenix Health and Wellness has been up and running and focusing more on the health and the wellness aspect and hormones and all of that. And so, yes, sex definitely has a role in all of that. That's why most of the people come to me, maybe not because they're having sex issues, or at least they don't say they are initially, but that ends up being probably 90% of the reason most of the people are coming to me.
Yeah, and so tell us that 90% of those patients, we were talking some numbers before the podcast, 90% of those patients might have some sexual issues going on, but how many of those come into you and that's the first question they ask, or that's their chief complaint, even though later on you find that out?
Oh, I'd say maybe only 20%.
Exactly. So the important part is as healthcare professionals, we've got to be open to the subject, and it's not taboo. And we've got to ask the question because a lot of times they won't. You want to elaborate on that?
Yeah, I mean, that's where I think I come in, and most providers, they're not going to broach that subject in your regular doctor's office, clinic, and most patients or people, even if they're having an issue, they're not going to feel comfortable. I mean, for one, visits are about 10 to 15 minutes. You don't have time to go in there. You're going in for high blood pressure, or you're going in for a wellness check. You don't often get asked that question. Hey, how's your sex life? Are you having any issues? Are you having any concerns? And if they do broach it, most of the providers, at least from patient testimonials that I hear, is that, like on the guy's end, hey, I think my testosterone's low. And doctor will be like, oh no, you're fine. You don't need to have it checked, or there's 320. No, you're normal. That's fine. We don't need to do anything with that. Same with women. I think my hormones are affecting things, and most of the providers are like, well, it's not safe to take this, so we don't want you to do that. Just basically, oh, here's an antidepressant. Maybe that'll help, and
Right. Right.
they're not treating the underlying issue. I mean, it's, you're not having a deficiency in an antidepressant. You have deficiency in hormones,
Well, and on that same subject, when, and I say this often, if a patient goes into a doctor's office and they are told, they're in their 50s, 60s, doesn't matter what age they are,
Mhm.
and they are told, well, it's just part of the natural aging process, that sex isn't as important as we age, go somewhere else, leave.
Right.
I mean,
Yeah.
immediately leave, because sex is just as important, maybe more important as we age. There's a lot of things as we age that are less distractions than they were when we were younger. Usually
Mhm.
our finances are better. There's not kids. If you're empty nesters, depending on your
Right.
age, there's not kids as a distraction anymore. I'm
Mhm.
personally saying this about mine and my wife's sex life. When our kids became older, and then when we became empty nesters, and even Janet went through menopause, and we got her on hormones. I mean, our sex life has become better than it ever has, because there's just so many. We don't work as hard as we used to. I mean, we do, but it's different, So if you're not thriving sexually as you age, there's a problem, in my opinion.
Mhm. No, I think it should only get better, quite honestly. I mean,
Absolutely.
once you have those stresses and new jobs and buying houses, and the kids are young and interrupting and different things as
Right.
they're older, it's definitely better. I mean, humans are wired to crave the intimacy of sex. And marriage requires that intimacy and closeness, as far as, being able to talk about your desires and wants. I mean, it's just important,
Well,
for any successful marriage. I mean, we can get into it a little bit more in detail too, but, I mean, people will ask, well, I think our marriage is great, but I'm not having sex all the time. Maybe 4 months will go by, and it's like, okay, is it fine for both of you? Are you truly happy, or are you telling yourself you're happy? I mean, if you could
Right.
have an orgasm every day, wouldn't that feel a little bit better? And
Of course.
really, a little bit of stress and anxiety and improved depression and all of those things. So
Yeah. So I like streaming our comments. You might know this person. Do you know this person?
I'm not seeing comments.
Oh, you don't see Celeste
Oh, there I
Ojeda?
see him. Okay.
Oh, do you see him?
Yes.
Hooray. Do you know her?
Yes, I do.
She's a fan of ours, or yours at least. So
Yeah.
thanks for watching, Celeste. Yeah, I totally agree. And with the marriage and intimacy thing, sex thing, it's what makes us different. It's what sets us apart.
Mhm.
I mean, other than just being friends. I mean, if you're not having regular sex, and what are you, just friends? And I'm not saying you shouldn't be friends with your spouse, but it should be way more than friends. And there should be regular intimacy. And
Mhm.
let's discuss, Jennifer, what is regular? You mentioned every 4 months.
Mhm.
Is that okay?
I think it is to what's okay is what's okay for each couple, and if you're satisfied with, oh, I'm losing my voice, sorry. If both partners are satisfied with their relationship, and by that meaning they're happy, they're content, maybe they're intimate in other ways, maybe they just cuddle, and that's the closeness that they're getting, and that's fine with both of them, then yeah, I mean, there's nothing wrong with that. I mean, I'm not saying, oh my gosh, if you're not having sex, you don't have a good marriage. It's just, hey, having more can really improve it pretty significantly.
Well,
And
and that's
I mean, I've seen that just in the last year of my own marriage. So,
right. Okay. And those things are important, and the cuddling and the intimacy part that might not necessarily qualify as actual sex are important. But let's talk about some of the things when we actually have sex and actually have an orgasm. Let's talk about some of the things that happen during that time. I hope I'm not putting you on the spot. But let's talk about some of the neurotransmitters that are released and all the benefits that happens when with an orgasm. But let me just tell you, it's probably better than any drug ever invented. So go ahead and elaborate on that.
Well, that was down on where I was going to talk about it, but sure. I mean, we've got, the endorphins, we've got serotonin that gets released. So obviously it's nature's antidepressant. The endorphins are those feel-good hormones. There's oxytocin, that same hormone that women secrete when they're breastfeeding, and that sense of closeness, which that's where you get the intimacy portion from, with all of these, increased blood flow, circulation. I can go through, kind of was curious. So I did a lot of research here just recently on, what are the benefits of more sex, and like you said, how often, and we can kind of go back to that as far as what is regular for most people. And what I found on most of the Google searches and everything was that, on average, once a week is actually average, which is 52 times a year. That's probably for more like 40 to 50-year-olds. 20-year-olds are 80 times a year. So they're, a couple times a week. 60-year-olds and over are 20 times a year. Those were the average. So you can see how it tanks as people get older. And most people feel like that is normal. They're like, well, I'm aging. We've been married a long time. It's normal not to have sex as often. And
I can tell you
that shouldn't be normal.
Right. And again, everybody's normal is different. But I will tell you, when you get healthier, and my wife and I have both been in situations where we were both overweight and not in the best health. And believe me, our sex life was not as good then. As you get healthier, you can have more sex. And erectile dysfunction for men, and I'm sure sexual dysfunction for women, can correlate to their general health. Definitely if you have hypertension, high blood pressure, which being overweight can do that, you're not going to get as good a blood flow. And so you can have erectile dysfunction, and women can, definitely be anorgasmic or have a harder time orgasming. But also, as we get healthier ourselves, and that's why it's important to have your hormones balanced and have somebody talk to somebody like you that, has been there, done that, walks the walk, talks the talk, about diet, nutrition, exercise. As we feel better about our bodies, I mean, let's just face it, we feel better about, wanting to be intimate with our partner. And I think I've seen personally, where people say, well, we actually have birthday sex, you're married. We actually have birthday sex. We have sex once a year.
Yeah.
And it's like, I mean, that in my opinion is, I get it. Everybody's normal is different, but that's not healthy. I don't think that's healthy. I don't think for a marriage and for your health in general. And I will say that in general, a lot of the people that do say that are not healthy, physically healthy themselves.
Right.
And I think probably it could be a psychological issue where it's like, I don't want my partner to see me naked or whatever. And so getting in general healthy is going to have you make your healthier sex life. And I will say this, talking about average, normal, you said 50, after you're 50 years old, it's once a week. So my wife is 55 years old, and the best physical condition of her life, she would not accept sex once a week. There is no way. I mean, if it's not daily, she's upset. Not upset. That's the wrong term. But we have a very healthy sex life. It's as healthy as we were in our 20s, and we were very sexually active in our 20s. So anybody that says that after 50, sex isn't as frequent, isn't as good, that's completely a lie.
Right. And I hear that so often from some of my patients, friends, different people that, now that they're on the hormones and the kids are older and all of that, they're having the best sex of their lives. They're closer. They love their partner even more now than they did 20 years ago. And it's amazing. And I think it is because you're very comfortable with that person. So, I mean, anything goes, it's,
Right.
bodily functions, whatever, it's fine. It's not embarrassing anymore.
You've raised kids together. You've seen them have babies. You've seen it all.
Yep. And you've seen each other at different stages, the heavy stages, the really good shape stages, not so much, all of the in-betweens, and you still love each other. I had a conversation with Chad the other day, just kind of in preparation for this. It was like,
so just for listeners and viewers, Chad is Jennifer's husband.
I was like, okay, was there any difference? Because I myself have gone through a journey over the past year where I've gotten in better shape and really fine-tuned diet and exercise and different things. So still not right where I want to be yet, but I do feel a lot better about myself. And I know that, the brain is the biggest sex organ there is, especially with women.
Oh, I would say men too.
As far as not wanting to be intimate because I didn't feel good about myself or, that sort of thing. And like, did you feel any different about me, the way I looked a year ago versus the way I look now? And he's like, no, it doesn't matter. He's like, what matters is that I know that you are getting enjoyment out of it. So when there's couples that, and I've been there, we all probably have at some point where you feel bad that you're not having more sex. And so you have sex because you know that they want sex, but you're not really in the mood for it. And you do it anyways. And sometimes that is okay, because you'll get into the mood, things will be like, okay, this is all right. And then sometimes it's not, especially people with sexual dysfunction, the hormones and different things like that. It hurts. It's dry. It's, your libido's just not there. You can't orgasm. Different things like that all come into play. But as long as you're both enjoying each other, even if, we had the conversation a little bit, do you have to orgasm? I don't know. I think as long as you're enjoying it and the other person is enjoying it and you're close and you're happy, no, it's fine. Obviously, it feels better when you do.
Well, I think, let's elaborate on that. So I think we have to define what sex is sometimes, because sex, I think traditionally has always been defined with at least the man orgasms. And sometimes it goes both ways. Sometimes the man will think, well, if my partner doesn't orgasm, then that means she doesn't enjoy it. And it really goes this way. If, women really get in their head that if the man doesn't orgasm, that means he doesn't enjoy it. And I think that's why it's important to have an honest and open conversation with your partner about what it does constitute. And sometimes just because you don't orgasm, whether it be male or female, doesn't mean you didn't enjoy it. And you need to talk to your partner openly about that, right?
Well, and I think that's the whole point of intimacy. It's you've been married and you're having this intimacy together, whether it's sex or just the cuddling and everything else that goes along with it, making one of you feel better, a massage, different things like that, talking. The more you do that, the more you're open to having just open discussions, about anything and everything. And hey, are you unable to, or no, I'm doing fine. I know you, whatever you need to talk about. But I mean, that's the beauty of an open relationship or open
conversation. So speaking of open conversation, Rochelle Monger, do you know her, Jennifer?
Yes, I do.
Okay. Having open, honest conversations, feeling good mentally and physically, like you talked about. Thanks for sharing that, Jennifer. About mentally, the women really need to get in their head. When balanced out is for sure the recipe for so many things in the life relationship. And on the mental thing with women, I just got to, this is why it's important for a man to confirm, be honest and open and confirm their spouse. And, I got to say, I mean, if you've been married a long time and obviously you got married, your husband was attracted to you. So when women get in their head that they're not, I mean, they don't understand that usually when their husband just gets a chance to see him naked, I mean, that's I mean, seriously.
Yeah,
I mean, and, you know, I can tell you times in our lives where, you know, I mean, where we couldn't, you know, run around the house naked because we had kids around.
Mhm.
It was just any kind of time I could see my wife naked was kind of nice, right? And so, you know, so even if she was thinking in her head that it's like, oh, he doesn't want to see me naked, it's like, that's just totally not true. And it's important as the husband to let them know. It's like, no, yeah, I get it. You've had two kids. You've had two kids, but believe me, honey, I am still super attracted to you.
Yeah. Yeah. Well, and I think that's the hard thing for women, you know, just being so
Yeah,
mentally
right.
critical of ourselves, you know, over so many different things. And I mean, and men are pretty simple creatures. I mean, no offense.
Yes,
I
yes,
mean,
we are.
basically, if they get the chance to have sex, it doesn't really matter. You know?
Well, and Celeste says this, true, naked is always a winner. Well, let me tell you, I mean, if you women want to turn your husbands on, I mean, all you got to do is just be naked. I mean, come and surprise him. And it's like, whoa, what was that? I mean, and believe me, you will be surprised how much that will turn your husband on.
Yeah.
And so, and it does go both ways, and he's going to probably respond to that. And then that just is a way to even grow your intimacy even closer, because then that's just a form of foreplay. And that's one thing, you know, you're saying kind of going through the motions with sex earlier. And there are times that you probably have to do that possibly. But, you know, if you do these things like go naked, then that is going to just make that build up even better. Right.
Mhm. Yeah. Well, and that's another thing too. I think one of the best words of advice that I ever got, and this was probably 15 years ago, was from another coworker of mine. She'd been married, I think, 35 years or something. She was an older nurse that I worked with, and I asked her, "What's the secret? You know, what's the secret to a good marriage?" Because I mean, she just every time she would talk about her husband and everything. I mean, it was just, I don't know, rainbows and sunshine, you know.
Right.
And I wasn't in that place in my marriage at the time, you know? So I was like, well, how do you do this? You know? And she said, Saturday morning sex. She said, we have it scheduled. My kids know that the door doesn't open. They don't bug us until we come out the door on Saturday morning. And they grew up that way since the time that they were little kids. And so they knew at least once a week they were intimate. She said sometimes they didn't even actually have sex. They just laid in bed and talked and cuddled and did different things, you know, because life gets in the way sometimes.
Yeah, exactly. Right.
Or you throw your back out or, you know, whatever. But
So
that was probably the best advice. And it was funny because when I was reading at, there was a psychology site that I saw as far as, hey, that's what they recommended too, is scheduling sex at least once a week. And because if you're not scheduling it, you're more likely not to do it.
Right. And speaking of that, there is I'm going to put a plug in. So Jan and I used to follow a podcast, and when we were kind of struggling in our marriage, and, you know, it was a time in our lives where we were going through transition. Our kids were getting older, but, you know, they're still in our house, and, you know, our lives were about ready to change. And we started watching this podcast, One Extraordinary Marriage. And they've got lots of tools. They talk very openly about sex, kind of like we do. And one thing that they recommend is they recommend scheduling sex, and the man will schedule it one day a week or whatever, and then the woman will schedule it one day a week, and on those days it's like, okay, well, my day's Tuesday. It's like you can't say no. And those are part of the rules you lay down. Yeah. And I mean, sometimes they'll tell stories of, you know, we were busy with our kids and we're traveling here and there, and it's 11:59, and it's like, okay, this is our day. We have to do it like right now, wherever we're at, just do it and then check it off the box. And I get it, because, you know, sometimes, like you say, if things don't get scheduled, it doesn't get done. But I will say this too. Once you get into the habit of scheduling something, is that then you don't have to schedule anymore. It just gets routine. It's kind of like,
No, it's just like working out.
I was just going to say, just like exercise.
I'm horrible with working out, and I really struggle with motivation and getting out there. It took Chad for years. He never wanted to work out with me. He just thought that it would just not work out well at all. And we decided, okay, no, we're going to work out every morning. It was otherwise I wouldn't get it done, And so we work out every morning together. We get up at 4:40 in the morning, and whether we like it or not, and it's not always lifting weights. Sometimes it's just cardio and stretching and different things like that. But we get up every morning together, and that has added to our closeness as well,
Absolutely.
And just as with sex, everything kind of starts to happen then, rather than having to schedule it. It's just, no, we get up, we do that. And,
yeah,
lots of times the just benefit of working out, leads to intimacy in other ways too. So.
Well, and I will tell you from personally working out with my wife, is that, I mean, not only is it's kind of, maybe it's not intimate, but it's physical. I mean, you get to see your wife,
mm-hmm.
Usually in, pretty, not a lot of clothes,
mm-hmm.
and you get to see her being physical. I mean, talk about foreplay in itself. And I will tell you, wives, if you ever are working out with your husband and you just happen to flash them, that's really, really good foreplay. It can be distracting, and I don't like being distracted during my workouts, but I will take that one. That's for sure. So anyway, and I wanted to be really open about my personal life, and Janet knows that I share it because we have a very, we're very active people in general, physically and mentally, but also sexually. And I think and we don't see that changing anytime soon. In fact, only getting better. And I'm 52, Janet is 55. And, we attribute that to, just diet, exercise, hormones, staying healthy, and sex helps us keep us healthy. I mean, if you have good regular sex, whatever regular is defined, you kind of want to stay healthy. I mean, right?
Mm-hmm.
So elaborate on that.
And there's benefits to it too. I mean, you can look at it as a way of getting healthy. So I mean, one of the things that I came across was, according to the American Heart Association, sexual activity is equivalent to moderate physical activities such as brisk walking or climbing 2 flights of stairs.
There you go.
You can lose up to 200 calories, with a vigorous session. So,
right.
You've got the motion of just having intercourse and sex can tone abdominal and pelvic muscles, hips, thighs, calves, torso. So for women, can improve bladder control. For men, it can improve overall performance. The penis is a muscle as well. So, you don't use it, you lose it, just as your biceps or, calves.
That's right. I was going to hit on that earlier, is about, also the importance of regular sex is that, many men experience erectile dysfunction. It can be due to health issues in general, which they can reverse. But also, like you say, if you don't use it, you lose it. I mean, the penis requires blood flow to get an erection, and if you're not doing that regularly, then it's going to be more difficult over time to do that. So,
well, and the same with women. If you're not getting the blood flow into the vagina, and you're not getting the moisture, during intercourse, you're releasing all of these hormones. You're producing the testosterone, you're releasing DHEA, you're all of these things that are beneficial. If you're not having sex, you're not releasing those as much.
Right. So you mentioned vaginal dryness earlier, and it's just one of the things is as women do age and they stop producing hormones, vaginal dryness, which can cause painful intercourse, is definitely an issue. So tell us about how you talk to women about that.
depends on where they are in their life. Obviously, menopausal stages, a lot of women have had hysterectomies, maybe early on, didn't realize they needed the hormones, or were told that they shouldn't have hormones, or were only on hormones for 5 years, shortest period of time. And now they're in their 60s and feel miserable. So we discussed different options, as far as hormone replacement. Some women are very hesitant to look at the estrogen, which can benefit and help with vaginal dryness pretty significantly, mood, night, hot flashes, different things like that, as well as the progesterone. But the testosterone, no matter what you do, I guess I should back up. You can improve the lubrication, but you don't improve the libido with estrogen alone. So testosterone becomes the most essential, and most women don't realize that they need testosterone just as much as a man does, and we lose it pretty significantly with perimenopause, menopause, and that's where that lack of desire, starts kind of coming in. The inability to have an orgasm, the clitoral sensitivity, different things like that are typically due to that drop in testosterone level.
Testosterone is a game changer for women. I mean, it is for men too, but I think it's underutilized in women because we typically associate testosterone with men. But like you say, women make testosterone also, just not as much as men. And yes, locally applied vaginally, it has huge vaginal benefits. Like you said, clitoral changes. That's not necessarily a bad thing. That can help for orgasms. Lubrication of the vagina. It does convert into estrogen, so will help lubricate the vagina. But also, it's absorbed systemically very well vaginally, which will, help increase libido, help increase mood, help increase lean body mass production, help increase fat production, help decrease fat build around the middle, help decrease cholesterol levels, decrease cardiovascular events. I mean, it is just
insulin sensitivity.
Right, bone density. There's not a better drug ever invented for bone density than testosterone. Yes, it's better than estrogen. So I can't stress enough, women watching or men watching, testosterone is so important for women. Make sure your spouse finds a healthcare provider that knows how to balance hormones, and specifically testosterone in women. Game changer.
It definitely is. I know I had a younger patient, when I say younger, that she was in her 30s, come to me, and she was one of the ones that specifically came because she wanted to improve her libido. She felt bad. She's like, I just never want to. And she's like, I love my husband, and I just always feel bad because I never really want to, and I don't really get much out of it, and he feels bad. And so, what can we do? And so we tried the testosterone for her, and she came in for her 3-month follow-up, and she was just like, I am absolutely blown away. She said, I didn't know that people were supposed to feel like this. She said, is this how, she's like, even in my 20s, I didn't feel like this. She goes, this is amazing. Yeah. And she said, we're so close, and, I'm enjoying things, and I want to, I'm initiating things, it was just, she was blown away that was how she should feel, or, not that you should feel, but that you could feel that way.
Yeah. That's a great story. And you and I in our practices, we hear that stuff all the time.
Yeah.
Here's what usually it's women that are a little bit older, or men. And, usually we see women in their late 40s, early 50s, and they come in and, they have the symptoms of vaginal dryness, maybe some hot flashes, decreased libido. Sex is either painful or they just don't feel like having sex. And one of the things that I'll tell the women is, after we, get their, even on their first, when they're first getting their prescriptions, it's like, okay, so this is going to be life-changing for you. In 8 to 12 weeks, you're going to be a different person. And then I ask them this, I'm like, so, how is your husband? And, then I'll start asking the questions. Does your husband, does he feel like having sex? Does he have erectile dysfunction? Oh no, we don't have regular sex. He doesn't feel like having sex. He's kind of not motivated, blah, blah, blah. It's like, well, you need to have him be ready, because in about 8 to 12 weeks, you're going to be ready. So, be prepared.
Yep.
And he might need hormone, and he probably does need hormone balancing too. So it's not really a warning. It's a good thing, but I tell him, it's like, your husband needs to be prepared. And I mean, you hear stories like that all the time, correct?
Yeah, I do. And I sometimes hesitate, not hesitate, but I talk to the men that come to me with issues. Because I'm like, okay, if we get you feeling really, really good, your wife might not be, on the same page. And so she may need to come to me too. And, some of them are like, oh, no, she's always... this is why I'm coming in, because we're having issues, and she wants this more than me. And usually it doesn't happen that way, because for what did I say? I think women after 50 or women after menopause, 44% of them have some sort of sexual dysfunction, which means, whether it's vaginal dryness or thinning or, pain with intercourse, anything like that. That's a huge amount of women that are.
That's a lot, right?
Not enjoying sex.
So let's talk about what are some things that are libido killers. You talked about when you talked about the 30-year-old and you put on testosterone, and I think of when I hear a 30-year-old and she doesn't have good libido, one of the common things I see is they're on birth control pills.
Yep.
Can you discuss that?
Yeah. So issues impacting basically the healthy sexual lifestyle, age, typically on the older spectrum, andropause, menopause, the hormones, decreasing levels of testosterone, DHEA, estradiol. Also, I'd like to add in vitamin D, because vitamin D deficiency, I find usually it's hand in hand with testosterone deficiency as well. The sexual dysfunction, which can either be just from menopause itself, or we've got excess weight, obesity or overweight, insulin resistance, stress, trauma, a whole bunch of different things can impact how you feel, basically.
And, from a pharmacy standpoint, medications.
Yeah. So
birth control pills.
SNRIs,
yes, which are SSRIs or antidepressants. And it's kind of a little bit of a catch-22, because you'll see women or men that have, some sexual dysfunction going on, and they'll go into a doctor's office, they're 50 years old, and they're like, oh, well, you're just depressed. So they give you an antidepressant, and it makes your sexual function worse.
Yep.
And we see that all the time, right, Jennifer?
Yeah. Well, even like metformin, which, there's some good benefits to metformin, maybe not so much that we're seeing in, more recent years. It used to be kind of the go-to to help reduce the type 2 diabetes and all of that, but that tanks your testosterone like almost 50%, doesn't it?
Yeah, it can. It can. I'm not a big proponent of using any drug for type 2 diabetes long term.
I'm not either. I usually go the whole diet and exercise changes.
It's a carbohydrate metabolism problem. And even if some people say, well, I'm not overweight, and some people have type 2 diabetes, they're not overweight. Okay, then don't eat carbs.
Yeah.
Don't eat carbs. Your insulin levels will go down. I guarantee it. If you don't believe that, this is a whole other subject, but if you don't believe type 2 diabetes is reversible, fast for 24 to 48 hours. I guarantee you your blood sugar will be normal.
Exactly.
Guaranteed. And that's just a reminder that it is diet related. So, and diabetes is a huge problem when it comes to sexual dysfunction.
Definitely.
Let's see, where was I going to go?
Also opioids, and just even blockers for acid reflux. Think how many people are on those. Chemotherapy, cancer treatments. So yeah.
What about alcohol? We often associate alcohol with sex, but I want to hear what your opinion is on this.
So I recently got a Garmin, and it is amazing to see the sleep score. So it does a sleep score, so you can kind of see how you sleep at night.
Mhm.
During the week, we eat clean. I mean, clean, high protein, very little carbs, not quite carnivore, but more carnivore, kind of
Yeah,
paleo.
I get it. Right.
During the weekend, we let ourselves slip. So, we'll have our wine or popcorn and some carbs, like we had burgers and whatnot this weekend. My sleep score last night, because we had wine with our nice steak, was 31. I didn't get any REM sleep.
And what's your normal? Make it relative.
83.
Wow. So yeah.
Yeah, and almost 2 hours of REM and 2 hours of deep sleep. And it's anytime I drink alcohol, boom, it's I'm awake more often. The movement is a lot more. The sleep score goes down. It's just been, I always knew it. I sweat after I have wine or whatever at night, but I never really realized how much it impacted the sleep. And obviously, if you're not sleeping good, everything else goes in the tank,
Absolutely. And we often are taught that, alcohol helps people sleep, and it is a CNS depressant. So it will put you to sleep initially.
Yeah.
But 4 hours later, it screws your sleep up.
Yeah. My deep sleep last night was right after I went to bed, and it lasted, I think, not quite an hour. And then I didn't have any other episodes of deep sleep and no REM. And I was up, and I think I was awake like 6 different times.
Right.
Ugh.
And directly when it comes to sex, alcohol can cause erectile dysfunction. It can cause anorgasm, so it'll make it hard to orgasm for men and women. I should say for women and men. And if you're not sleeping appropriately, like you say, nothing gets better.
Yeah, it can release some inhibitions, but it can actually dry, vaginal dryness and things like that.
Right. Well, and here's one of the things. We got a comment from Steve Goldring. You probably have heard of him. He's at the conferences.
Hi, Steve.
Hormone guru pharmacist. Thanks for commenting, Steve. And yeah, struggle with sleep and alcohol makes it worse. And we think it makes it better. But and some people think that partly because they need to be relaxed in order to sometimes feel comfortable to have sex.
Right.
And so they think it makes it better. But I will tell you, people that think alcohol makes their sleep better, makes their sex better, they've never done it without it. Because I challenge listeners and viewers that if you go without it, it will be better.
Most definitely.
So Jennifer, as we wind this podcast up, what are some parting words you would like to end with?
So I guess the biggest thing that I'd like to part is that, an active sex life is possible at any age. It doesn't have to be an inevitable part of aging and the menopause and the andropause. There's no reason why we can't enjoy a healthy sex life well into our 70s, 80s, and 90s. We just might have to reframe what it looks like. You might not be able to physically have sex 3 times a day on a Saturday.
Yeah, right. Although maybe you will.
maybe, there's different ways around it, but I guess it just changes, as we age. And the most important thing for people to understand is it's important to invest in yourself and in your relationship. Improve your health, set a goal. What do you want to do in 10 years? Do you want to be able to go hiking? Do you want to just be able to climb some stairs? Do you want to be able to have sex 3 times a week? Do you want, what do you want? And set a goal. And what is it going to take to get you there? Eating better. If you just want to be around for your grandkids and be able to get down on the floor and play with them and be able to get back up again without somebody helping you. Improving the diet, eating single ingredient foods, increasing protein intake. Our nation, we don't eat enough protein. Exercise regularly, get good sleep, limit the alcohol, have sex.
Yeah, right.
Optimize hormone levels. That's one easy, surefire way. Not that I'm trying to promote that, but obviously that's why we're here too. But the hormones make such a difference. And I guess, when I was learning and going through the education to become a nurse practitioner, they kind of frown on you sharing personal experience with your patients. And I find that most people, at least in the wellness aspect and the hormone aspect, like it when you've been through similar issues.
Right.
I have endometriosis. I had the Lupron shots that put me into menopause. I had painful issues. It hurt. I didn't like it.
Sure.
Until I went on the hormones and reversed things, it wasn't fun. I was one of those people that we probably didn't have sex maybe every 3 to 4 months. And it's embarrassing to look back at now, and we see how far we've come,
Yeah.
For different things. But it's like, because I can relate and understand, and I'm on the hormones and I know side effects, what to expect. I think people feel like they can talk to me and are comfortable. I know the questions to ask. So they're like, oh, okay, yeah, this is an issue. One of the first questions I ask men are, do you wake every morning with a morning erection? And most of them are like, oh, no, haven't done that for quite a few years, and it's like, okay, then you're probably low on testosterone.
Yeah, that's right. That's a problem. And it can be fixed.
Mm-hmm. Women, are you losing your hair? Do you not have any more pubic hair? Do you don't have to shave as much? Have you lost your clitoris? That's usually an indication that those hormones aren't there anymore. And if we replace those, you'd feel a lot better and you'd enjoy things a lot more too.
Yeah, for sure. So back up on, you said into your 90s, I got to share a story, a patient story. And he was an 89-year-old patient, and he's still alive. He must be in his mid 90s now, and he was on testosterone. And when he was 89, and he was actually a doctor also, and he'd been retired for quite a while. And he was just one of those guys. My grandma used to always say, "I can't wait to get old." And this was like when she was in her 50s, because you can say anything you want and you don't get in trouble for it, right?
Exactly.
So this guy, he was an 89-year-old man that could just say anything, and he did. And anyway, he came in, he goes, "Oh yeah, no, if I don't have regular sex," he said, "put a bullet in my brain." His words, not mine.
Mm-hmm.
It was that important to him and his partner. And I just remind people of that, because it is, and I said it early on, I think in some ways it is as important as food and water.
Yeah, I think so too.
To a lot of people, especially.
Yeah, I had a little lady that I met last week, and we were just having a conversation, and talking about marriage. And I was like, hey, I said, this might be kind of odd. Do you mind if I ask a personal question? And she says, well, I'll probably answer it. That's okay. And I said, well, you don't have to. And I said, because she was in her 80s. And I said, are you still intimate with your husband? And she goes, well, no, unfortunately, we're not. And she said, but if we could be, we would be. He had a series of bad prostate surgeries 15 years ago, and issues and whatnot. And so I was talking, oh, well, have you looked at penile implants? And we were just, the conversation kind of went off track, and she was just, oh, I didn't know that existed. And oh no, send me some information. And it was just kind of, okay, we're having this conversation, but it was fun. It was neat. It was like, no, she's they both would if they could, know. Obviously they're intimate in other ways and whatnot, but she's like, no, she said he's tried to help me out, and she's like, I just feel guilty because he can't. So it's just better if we both don't. So.
And that's why it's important for us as healthcare professionals to ask those questions, so those people can be open and honest with us, because a lot of times it's the first time they're able to. Many times. Yeah.
No, she's like, oh, I love being able to talk about this.
That's cool. And she's in her 80s. That's awesome. Yeah. I've got, there's a story a couple months ago, actually. And this guy called me, and he was having some issues with his testosterone. I just had some questions, and so I asked him the leading questions like, well, how's your sex life? He goes, oh, it's great. It's better than it's ever been. And his wife, they're in their 70s. And his wife's in the background and said, tell him we don't want to stop what we're doing. We're not going to stop that, blah, blah, blah. And it's like, I mean, it's cool to hear this from 70-year-olds. I mean, his wife is yelling at him. It's like, no, we are not going to stop having sex. I mean, that is not what we're talking about. That's just cool to hear. And it's a reminder that we can have healthy, regular sex well into our 70s and 80s.
One of the things that I didn't talk about as far as, I mean, obviously we talked about some of the benefits of regular sex, the aspect of positive cardiac benefits. So I wanted to put the caveat in there that, okay, regular sex can lower blood pressure. I found a study that said sex at least 3 times a week lowers the chance of having a heart attack or stroke by 50%. That being said, infrequent sex can strain your heart. So if you're one of those people that you're only having it on birthdays or, every few months, you might have more of a chance for having a heart attack because of the strain on your heart than if you were having regular sex. So I thought that was just something to kind of.
It is interesting, and I'm going to comment on that. I think it's a little bit. Is it a chicken or the egg thing? Is it that some people don't have regular sex because these same people are at risk for cardiac disease, and so they've already got maybe erectile dysfunction or they're not healthy already, so that's why? Or is it also that regular sex keeps us healthy? I think it's a little bit of both, honestly.
I think so too. Yeah, I would agree there.
Yeah.
I found a couple other funny studies that we didn't get into, but there was a 2016 study that showed men who had more ejaculations, like 4 to 5 times a week, were less likely to develop prostate cancer than men who had 4 to 5 per month. Daily sex can take 7 years off your face, improve skin elasticity, and it can prolong life expectancy, longevity. It said people who climaxed 3 times a week had a 50% reduced chance of dying for any medical reason in one study that I read.
And I think, again, it's just an indicator that if you're healthy, you have regular sex.
Mm-hmm.
It's just another indicator, and it keeps you
regular
healthy.
Sex can keep us healthy.
Exactly. And we really shouldn't be surprised if we look at it from a biological standpoint. I mean, sex as reproduction, which is, as humans, it's much more than that. But if you're able to reproduce, it means that you're healthy. That's one thing that it means, or your genes won't get passed on. So we really shouldn't be surprised that, healthy people have sex, and sex keeps us healthy. Mm-hmm. So Jennifer, as we wrap this podcast up, what do you have a passion for?
My passion is seeing people in their follow-up appointments telling me that, oh my gosh, I feel amazing. Thank you so much. Just everything's great. I feel like I'm 20 again, or just that smile on their face when they come back and are like, holy cow, or thank you for saving my marriage. I treat a couple of couples, and they usually have meetings with me together, kind of separate appointments, but they're usually both on the podcast. Like, everything is just amazing. Thank you so much, and it's just a pleasure to see that and to be a part of letting people feel good and improving their lives.
Yeah, it really is. I will tell you, it is very rewarding. It's one of the reasons that my wife and I love taking care of hormone replacements or people's hormones so much, because you just see the benefits of it. You see, you change people's lives. And I will tell you that when we were doing regular traditional pharmacy stuff, that just wasn't happening. I mean, people don't come in and say, oh, I'm so glad that you dispensed that statin for me so you can lower my cholesterol, or I'm so glad you gave me that blood pressure medication so it'll lower my blood pressure. But, when you change people's lives, either sexually and physically and mentally, because of hormone replacement, it is very, very rewarding.
Yeah.
So Jennifer, tell us how we can get a hold of you.
I think you have my website there. So that's probably the best way. Under the Others tab on the Phoenix Wellness website is portal registration. as well as an appointment tab to schedule an appointment. You can always call. My phone number's on there. My email's on there too if you have specific questions prior to an appointment as well.
Awesome. Awesome. So what is your website? Phoenix Health and Wellness Spokane.com.
Yes, it's a mouthful.
Yeah, it is. But I just Google it and it comes up. So
Yeah.
It's pretty easy. Well, thank you, Jennifer.
Oh, and I did want to say too, for people that are listening, I am licensed in Montana, Idaho, and Washington.
Awesome. And you do virtual appointments, correct?
I do. Yep.
Awesome. So you definitely helped us realize our goal, Jennifer, which is to educate and empower individuals to take charge of their own health. And sexual health is an overall important, just as physical and mental health is, and it'll help keep your whole body healthy. So thank you for being on. I really appreciate working with you. And listeners and viewers, thank you for watching. Thank you for listening. Thank you for commenting. You don't want to miss out Thursday. We're actually going to have 2 podcasts Thursday. Speaking of cardiovascular health, in the morning, I'm going to be educating or interviewing a cardiologist who actually changed the way he practiced because he noticed that these people that he was doing all this cardiovascular surgery on were not getting any better. And they were coming in again and again for bypasses or for stents. And it's like, so he actually wrote a book about how to stay off his operating table. And we're going to be discussing cardiovascular health. And it goes hand in hand with what we're discussing today, actually. So you don't want to miss out on that. 8 a.m. Pacific Standard Time, Thursday. And special podcast with John Stockton, 4 p.m. I will be meeting John Stockton in Spokane. We'll be interviewing him in person. And we're going to be talking about medical freedom. So how did an NBA Hall of Famer all of a sudden turn into somebody promoting medical freedom? You are going to hear all about his story, and you don't want to miss out on that. So, Jennifer, thank you for tuning in today. Listeners and viewers, thank you for tuning in. Health Solutions with Shawn and Janet Needham. Thank you.